Okay, so let's say I have a patient and they're A positive. What kind of blood do I want to give this patient?
A positive.
A positive. So that's option 1. What is my second option if there's no A positive available?
A negative.
O negative. Okay. Those are the only 2 options. Okay. I mean, yeah, sometimes you can give a negative to a positive, but this is the way they like to do it. They like to do either what they are, and then O negative is like the second best.
How come
option.
you can't give an A negative?
Because we don't want to mess with RH factor a whole lot.
But then
So-
aren't you kind of messing
I
with
know, I don't know. That's just what we were taught by Sister Hunter. So, I mean, I don't know if you want to like start looking that up in the book, but just O negative.
I'll trust you.
Yeah, so that's what she taught us. So, this, I mean, you guys know about like type and cross match, right? So we're hoping that a lot of stuff gets caught, like if there were bacteria or if there was a problem with the antibodies matching up or whatever. There should be no reactions with either of these if they were typed and cross matched properly. So even though I'm giving O negative to an A positive patient, there should be no problems. Even though I wasn't able to give A positive, O negative is still
What
a
does
good
it mean
option.
to be like crossed?
So, does anyone know?
We
Who
went
wants to tell
over
us?
that. You take
Take blood from
the patient
and then the
and
bag.
then from the bag and see if they
And
match and see if they have any
Oh,
reactions.
okay.
Yeah, and how long do they sit together?
30 minutes?
15. Yeah, 15 minutes. They just put them in like a little test tube and see if anything happens, if it clots or if it does some weird separation thing. I don't know what they all look at, but they should hopefully catch a reaction before giving the patient the blood. That's the point. Like that. Okay. Now, let's talk about the reactions. I don't think we really need to go into all of them, but on those, there's like 2 or 3 slides that talks about like blood reactions.
Yeah.
Look at the signs and symptoms and then what you would do about it if you, because she's not going to say your patient starts having a febrile reaction.
But that's
What are you gonna
normal,
do?
right?
A 1 degree increase is normal, 2 degrees and above is not.
For
For
blood transfusion?
blood transfusion, yeah. So it is normal for their temperature to fluctuate up or down by 1 degree, but if it's 2 degrees or more, that's when they say that's a reaction.
So are you talking about like if they have like a bacterial, or an allergic reaction like itching, flush,
Yeah.
lower back pain?
Yeah, so then what would you do? Because she's not going to come out and say an allergic reaction. She'll say the signs and symptoms, and then what do you need to do about that?
So it's always like stop the cause of it.
Yeah, it pretty much is always like stop the blood. But
And
then there's a few
flush
that
with
say-
normal saline.
Like with, not necessarily, sometimes if the doctor tells you to flush with normal saline, you'll flush with normal saline, but not always. So don't just think you're going to do that. It's an MD order to flush with normal saline. And he might tell you to do that, or he may not. What do I give with an allergic reaction after I've stopped the blood?
An antibiotic.
So that's called an antihistamine. Yeah. Antihistamine.
And
So
then if they have
always stop the blood before you do one of those things.
Wait, so would you give an antihistamine real quick before you call the doctor, or do you have to call the doctor to get the antihistamine?
I think you have to call the doctor, but that's just what you're going to be doing. And once you call the doctor, never give a med before you have an order. And an antihistamine, even though it's just like Benadryl, is still an order, a doctor's order. So yeah, call the doctor.
Okay.
Yep. And there's usually a doctor like in the hospital, like what are they called? Like if you can't get a hold of their doctor, there's always a like attending
Like a
on the floor, like a general on-call doctor that you can call. So, yep. So know all 4 reactions, the signs and symptoms. So what are my signs and symptoms for? I'll erase this. So if my patient is having a febrile, this one's easy, reaction, what is my main signs and symptoms going to be? Temperature. Yeah. Increase in the temp.
Would that one be like above?
2 degrees above the
degrees,
baseline that
okay.
you did before. So you guys know that when we start blood, we take vitals right before. Hang the blood, we take them at 15 minutes and 15 minutes and like constantly. So this will be very noticeable from your baseline. Okay. So what do? We said you stop the blood and you give the antihistamine. Or no, Tylenol.
Yeah.
Tylenol, because this is for fever. Okay. So that's it for that one. What about the hemolytic reaction?
Is that where they're clotting?
Yeah. So good. So the hemolytic is where the red blood cells from the patient's blood and the bag are clumping together because they're not compatible. So that kind of helps you to know what the signs and symptoms are. So those clots are going to head to my kidney and they're going to get like stuck and it's going to cause a lot of damage in my kidneys. So that's why you have that back pain. Right? Because my kidneys are back here on my lower back. So that's why we have the lower back pain. And I think it also causes like nausea and vomiting. Wasn't that the other signs and symptoms? So what do I do for this patient?
Stop the blood.
Yes. And I think it says antihistamine, right?
Yeah. I think it is.
Antihistamine.
So these are all like, you get a fever, you get hemolytic reactions, you get all these when you have a blood.
You can get any of these.
Or you can get a mix.
You could get a combination too. Yeah. But usually it's going to be, on the test purposes, it will be like, you'll know which one it is. It's going to be one reaction.
Okay.
Separated. So what were the others? We had bacterial.
Uh-huh.
What were the signs and symptoms for the bacterial?
That one, I mean, can't you repeat that one as well?
Yeah, you could if it was like dirty blood.
Is it like your high heart rate? Low
Yeah.
blood pressure,
And just,
shock?
yeah, just to like let you know, this one is super uncommon.
Okay.
Because we've done, like, they test blood so much nowadays that they would be able to catch hopefully anything that would cause a bacterial reaction. Which one of these is the most common?
The fever?
Yeah, because that's not really something you can like be prepared for. Like the hemolytic hopefully would not happen because I typed and cross-matched really well. The bacterial hopefully wouldn't happen because they check the blood, they clean, like they watch it, they refrigerate it. You know, they're really strict about that kind of thing. So that's where I do the culture and the antibiotics. And what do we always do with cultures and antibiotics?
Do the culture
Do
The
before.
culture first, then the antibiotic. So, and then what was my fourth reaction?
With the anaphylactic shock.
And what were my signs and symptoms for that one?
Are they gonna have a rash?
Mm-hmm. It's kind of like allergic. Remember how we talked about like allergies and anaphylaxis last
So this
semester?
one- Yeah.
Where you kind of get the itchiness and the hives first, and then if you don't do anything about it, it can go to the airway.
Yeah.
So that's the important thing to remember is you kind of start out with like a rash, hives, and then if you don't do anything about it, it can cause airway problems. And so this one is stop the blood. And then what do? I give a
You wanna get it out of their system, don't you?
Antihistamine.
yeah, so it's like hemolytic antihistamine. And then like your doctor may or may not order normal saline for any of these. So you might be flushing them with normal
It's good to
saline.
know
you
because I
might-
thought rather very careful. It's like
You always flush it with that.
Yeah, I don't know.
Wait, so you don't flush it with normal saline?
You might if
Unless
the
it's-
doctor orders it.
But how would you flush it? You flush their whole, oh, you just like put normal saline in their IV or something?
So that's a good question because I've had a lot of people ask about like how to do that because you do not use the same. I think he taught that you guys use the same line. You do not because. So you guys should know about piggybacks and all that
You
stuff.
never use the same line when you're using it, when you're putting blood in, right?
Yeah, so
Don't you use a wide bag? or
No,
something?
you can use
You use, you can.
you always use Y tubing.
Yeah,
Yeah.
and that's the same.
It's different than a.
No, she's just saying
Primary.
like the same tubing. Like
Oh.
the Y tubing, it's not the same, but like it's one,
Okay.
like,
There's two
Yeah.
only connect to one.
yeah,
Yeah.
exactly.
So they come down and they connect to my filter,
So I guess.
right, and then it goes to my IV pump where it goes in, right? So,
Uh-huh.
so this is my blood. and it's running, and my normal saline is up here. Here's my clampies, right? So I prime my whole tubing with normal saline, and then I clamp it up. So this is clamped, not running. And then I open up my blood, and this is running through my patient. If I have a reaction, I need to stop my blood, I clamp this, and I unhook this tubing from the normal saline. Okay, so this tubing, gone, that's with the blood. I put a new fresh line and hook it down here, right at their IV port. I undo the Y tubing from
You want
them.
it in there as quickly as possible.
Yeah, do I want to send all the blood that's in this tubing into the patient if they're having a reaction?
Okay.
No, because I think some lines, especially Y tubing, it's really big, can hold like 50 mils. So you would be sending 50 mils of, and if they were having, maybe that would be okay for a febrile reaction, but what if they were having like a hemolytic or something where it was clumping with their blood? So always get a new line, prime it, hook it up straight to their port, and then just start your flushing. I'm gonna look that up tonight actually, on whether or not you just give it or if it needs a doctor's order. Because Sister Hunter taught us that the MD would order whether or not they wanted the normal saline flush, but maybe it's standard protocol that you could without a doctor's order. I don't know.